The main purpose for patient undergoing the treatment is to alleviate pain resulting from inflammation of dental pulp. Inferior alveolar nerve block, considered to be the most standardized and most frequently used injection technique for pulpal anesthesia and mandibular molars. Previous studies have showed that failure of inferior alveolar nerve block rate ranging between 43% and 83%. Local anesthesia failure can result from operator technique, pharmacological issues, anatomical landmarks, and tissue like inflammation. Inflammation can alter tissue pH and increase vascularity, potentially leading to reduced effectiveness of local anesthesia. Also, buccal infiltration technique has been used in mandibular teeth in various studies as a primary or supplemental injections. Studies have showed that the success rate of buccal infiltration and lingual infiltration achieve profound pulpal anesthesia is between 32 to 63% in lidocaine and 57 and 92% with articaine. Also, preoperative medication with NSAIDs has shown their ability to prevent the establishment of peripheral nociception and inhibit the production of inflammatory mediators. And that is how this group from Egypt justified the reasoning behind their study that was issued by the Australian Endodontic Journal in 2024 with the title The Effect of Ibuprofen Sustained Release Oral Premedication on Intraoperative and Postoperative Pain, a randomized clinical trial. The aim of this study was to assess the effect of ibuprofen sustained release oral premedication on the efficacy of buccal infiltration with intraoperative and postoperative pain after single visit root canal treatment. For their method, authors determined the required sample size based on their findings from previous study using G-Power statistical software. So the final sample size for each group was determined to be 30 subjects, making the total of 60 participants for the study based on their inclusion criteria. And their inclusion criteria were healthy patient, age range between 18 to 45, teeth are mandibular first and second molars, diagnosed with symptomatic irreversible papyrus and symptomatic apical periodontitis. Participants were randomly assigned into either sustained release group who received 800 milligram ibuprofen or the placebo group who received placebo 1 hour prior to the procedure. Also, the clinician who were performed the procedure were also blinded. So this is a double-blind clinical trial. The clinical procedure, anesthesia administered via buccal infiltration using 3.6 milliliter of 4% articaine with 1 over 100,000 epinephrine. Standard canal preparation performed including instrumentation and irrigation, pain assessed via visual analog scale, pre, intra, and post-operatively, ibuprofen prescribed for post-operative pain relief. Patient instructed to record their pain levels and medication intake. Pain was recorded in 6 hours, 24, and 48 hours. Then the statistical analysis. Continuous data were analyzed using Mann-Whitney U tests, and categorical data were analyzed using chi-square test with a p-value of 0.05. Their finding relieves the finding of the study relieved that sustained release group demonstrated a significantly higher anesthetic success with 73.3% compared to the placebo group, which is 46.7%, with 1.6 times higher success rate. The intraoperative pain intensity measured by mean of visual analog scale values was significantly lower in the sustained release group 2.8 compared to the placebo group 4.5. However, there were no statistical difference between both of the group. However, also post-operative pain intensity showed a significant difference between the group at 6 hours and 48 hours, but not on 24 hours. The sustained release group required little energetic frequently, with a percentage 26.7% compared to the placebo group with 60%, with a significant difference observed. So, in conclusion, this study concluded that ibuprofen sustained release improved the efficiency of primary buccal infiltration anesthesia and mandibular molars with symptomatic irreversible pulpitis and apical periodontitis, significantly decreased the post-operative pain intensity at 6, 48 hours, and the need of the pre-medication was less.